Welcome to Living Outside the Matrix, the philosophy show where we shed light on very important issues that are either misrepresented or ignored altogether in the mainstream narrative. Hi there, I'm your host, Nigel Howitt, and on the show today, we're going to look at psychology and a way in which we can address the various psychological and emotional challenges that we all face in our daily lives. But the big deal about the method that we're going to discuss today is that it turns upside down a popular belief held in the mainstream and also held by most in the psychological fraternity. But before we get into that, it's a great pleasure to discuss this subject with Dr. Michael Edelstein PhD. He's a clinical psychologist and author of the book 3-Minute Therapy. Dr. Michael Edelstein, thank you so much for taking the time to join us today, and a warm welcome to the show.
Oh, you're welcome, and thank you for inviting me. I've been looking forward to our talk.
Dr. Edelstein, what is it about your approach and your method that sort of, apart from the fact that it aims to do away with the therapist, which I quite like, what is it that really sets it apart from other conventional therapies?
Oh, well, there are many things that do. So let me explain some of the basic premises, and then that will become clearer. And it starts with where our emotions and behaviors come from, and that's a major difference between traditional therapy and what I do, rational emotive behavior therapy, REBT, which was devised by a genius in the field, Albert Ellis, in the 1950s. So the first assumption is that our emotions don't come from situations from our past upbringing or our genes or being fired, for example. None of these things cause our emotions, but rather our emotions and psychological feelings and our actions are generated by our thinking, the ideas in our head, what we tell ourselves, our attitudes, beliefs, views, opinions, what we tell ourselves at the moment about the situation that causes our emotions and behaviors, not the situation itself. So, for example, a common problem I help people with is stress at work. So I'm stressed because my boss is always criticizing me. So that's a common statement. But it's not your boss criticizing you that causes you to be stressed, but it's what you tell yourself about it. For example, this is awful that my boss is criticizing me. I'm about to be fired. It's the end of the world. The boss must not criticize me. I can't stand having a boss that's critical. So it's those ideas that cause our emotions, not the situation. So for example, if we thought, hey, this is going to give me an excuse for leaving this job and finding a better job, I'm going to document it, and I'm going to feel better about leaving the job because I have some tangible reasons for doing so, then I won't feel so stressed. I might feel relieved or happy because my thinking has changed, my view has changed, not the situation itself. So that's a major difference.
So, let's remind people, perhaps our listeners, that the mainstream view, which Freud put about, perhaps you can correct me on that if I'm wrong, but I understand that he suggested that, and many others sing from the same hymn sheet, that emotions are sort of unfathomable, mysterious things that we don't know where they come from, or we're born with these or innate drives and urges and all this sort of thing. So you're actually turning that idea on its head and saying, no, actually we can understand emotions. We can see that they effectively swing on our thinking. Is that true?
Yes, exactly right. It's not so hard to understand our emotions, and usually in a first session with a client, I explain to them this principle, and then by the end of the session, they're pretty much on board and understand where their emotions come from. And as you mentioned earlier, Nigel, that's part of teaching my clients to be their own therapist. Now they can diagnose what the problem is, it's their thinking. And we'll get into more specifics of that. But I did want to mention that you said that Freud popularized this idea of our emotions come from situations. And he did in his perverse way. But actually, it's very human to think that our emotions come from situations. Listen to anybody talk, the most brilliant philosophers and scientists, and they're saying that this is going to make me feel better, or that is making me feel unhappy, rather than it's what I'm telling myself. So it's very human to think that way. And that makes it more difficult for people to implement. Not to understand, it's easy to understand, but it's harder to implement it and feel it deeply and believe it. And that's where a lot of practice comes in. And that's another difference between REBT, rational emotive behavior therapy, which spawned many of the cognitive behavior therapies that you might have heard of more popularly than REBT. Mm-hmm. And so that's a major difference between those approaches.
We see it in sort of colloquial speak, don't we? When we hear people say, "Oh, you make me so angry," or "This makes me feel happy," "This makes me feel sad," or we often hear things like that, don't we? In people's common speech. So I suppose. I wonder which is the cart and which is the horse there. Are people expressing the sort of the incorrect nature of things? Is it just because of the immediacy of emotions? Things happen and all of a sudden, like a lightning calculator, we feel something, don't we? You can feel fear in a split second in a reaction to an event. Do you think it's just the suddenness with which our emotions are sort of calculated? Or do you think, people just get into bad habits of speech, I suppose?
Both are the case, but I think another way to explain it is using Frederick Bastiat's notion of the seen and the unseen. That okay. We see the situation, we see or feel what we're feeling, and as you said, it happens semi-automatically. It seems like it's automatic, but we don't see our thinking. That's the unseen, and that's one of the nice things about REBT, and which Stoicism emphasized also, and that is it's our thinking, the unseen, that causes our emotions, and it's not what seems obvious or logical superficially. Okay. By the way, I started to mention, Nigel, another difference to respond to your question about that between this and more traditional therapies, and that is once it's obvious to you that it's your thinking that's causing it, it's still easy to think and say, well, you made me angry, or getting fired depressed me. It's still easy to say and think that, even though you know that's wrong. And what REBT features is the importance of practice, repetition, review, reinforcement, going over these ideas in a structured, organized way, which I teach my clients again and again and again until it finally sinks into your brain.
So also, just to clarify another idea, when you say it's the thinking that we can't see, I suppose that you mean our premises sort of buried down in our subconscious, the things we've decided are true and aren't currently the subject of anything we're thinking about.
We have these premises that govern us, like it's terrible, I'm fired, or I must not get fired, or things like that, but we're not quite aware of it. Or you could call them tacit assumptions, or prejudices, or biases, or things like that, that we all have, and we're not, but we're operating on those things often, and we're not aware of them.
Great. So, before we get into more of the nuts and bolts of the 3-minute therapy, one of the points that you make in your book that I gleaned anyway is that there's no need. You challenge the conventional assumption that we need to sort of dig up the childhood and, oh, what happened in your past, and we need to sort of regurgitate it and recycle it and chew over it and examine it, which seems to be, I mean, I'm not a therapist, but I have had psychotherapy in the past, but it seems to me that that's a very common theme of all attempts to help people with their problems, and you challenge that. Is that correct?
Yes, that is a common theme. Even in the more modern therapies, like some of the cognitive behavior therapies, they have that assumption that it's our childhood. So let's talk about what happened when you were 3 years old and your mother dropped you on your head, or your father abandoned you at the age of 5, and that's why you are the way you are. But it's the same era, that it's a situation in your childhood this time rather than in your present that's causing your emotions and behaviors and psychological problems now rather than your thinking.
Right. Yeah, it's interesting, isn't it? And another thing that I gleaned from your work also is that you talk about this thing where you're separating practical problems from emotional problems. Maybe you could just expand on that for a while, because often people sort of come in with a big jumbled up muddle of problems, don't they? And I guess things need to be sort of sifted out to work out what's what before you start.
Yeah. So you raised a very important concept that I normally explain to my clients in the first or second situation, and that I discuss and give examples of in my book, 3-Minute Therapy, and that's called the problem separation technique. So as we go through life and as we go through the day, we have challenges, and we want to overcome these challenges, like how to keep healthy, how to get to work on time, how to improve your relationship with your partner. So these are challenges. And then, so I call those practical or reality problems. These are practical problems, and I teach clients strategies, techniques, and ways to work on these practical problems. But then, being imperfect humans, we often escalate these practical problems into emotional problems, emotional disturbance. For example, let's suppose I want to get up early tomorrow morning to get to work on time. I have a practical problem. How do I do that? Do I use an alarm? Do I ask my partner to wake me up? Do I go to bed extra early to make sure I don't oversleep? So that's a practical problem, and those are some possible practical solutions. And then we use trial and error, experimentation to see what works. But then, being an imperfect human, I may escalate that practical problem into an emotional problem. I get anxious about oversleeping and being late to work, or I dread facing the day of another unpleasant day at work, or I get depressed that I'm still stuck in this same job that I don't like. So those are the emotional problems. So there's the practical problems and the emotional problems. So the question is, why is it useful to figure out what's the practical problem and what's the emotional problem? And the answer is because when we identify emotional problems, like I'm anxious about oversleeping, that's an emotional problem, then I use particular emotional problem-solving concepts and strategies to work on those. But then when I identify the practical problem, I use practical problem-solving strategies, as I mentioned, like trying an alarm clock or trying a wake-up service or those kinds of things. But if I try to solve the emotional problem with practical solutions, or the practical problem with these emotional solutions, it's normally not going to work, or not as well.
How would you kick us off with the 3-minute therapy? Can you walk us through the steps of it, through the procedures? I noticed you have a sort of an ABCDEF structure. Would you like to sort of guide us through with a couple of examples?
Certainly. So, and let me explain one more concept in addition to the couple I have explained to fill out the outline. And that is, so now we know that our emotions come from our thinking. And it's the same thing with disturbed emotions, emotions that eat us up inside that we're better off without, such as anxiety, depression, anger, guilt, embarrassment, those kinds of things. And these disturbed emotions come from a particular type of thinking, and that's thinking in terms of demands. Must, should, supposed tos, have tos, demands we put on ourselves, others, and situations. So let's walk through what you mentioned, the ABCDEF, which I call 3-minute exercise. So let's suppose I'm feeling anxious about oversleeping tomorrow. So normally I start with C. C stands for undesirable emotion or behavior, or any emotions I have or behaviors I have that are interfering with my goals and I'd like to change. And usually we start with C, which is not necessary to start with C, but usually we do because people are most aware that I'm drinking too much or I'm anxious, so normally that's easy to identify. So C would, in this case, would be anxiety.
Okay.
I'm better off without the anxiety. If anything, the anxiety might lead me to oversleep or not sleep at all because I'm up all night worrying, or so C is anxiety. Now we go back to A and follow it through alphabetically. A stands for activating event or associated event, the activity or the situation about which I'm anxious. And in this case, it could be, suppose I oversleep and miss work. So A is suppose I oversleep. C is I'm anxious about it. But we know as REBTers that A doesn't cause C. The possibility of oversleeping doesn't force me to be anxious, but rather it's B. B is my belief, as
right.
Particularly irrational belief. And irrational belief is one of those musts. And I must, you must, or life must be a certain way, go well. So in this case, it could be, I must not oversleep and be late for work.
Mm-hmm.
So at A, B, and C, we pretty much diagnosed the problem. A, the activating event, I suppose I oversleep. B, the irrational belief about the event, I absolutely must not oversleep and be late for work, and that causes C, which is my anxiety. So B causes C, my belief causes C, not A, not the situation.
So you have anxiety as a sort of a consequence. That's the thing you're trying to address.
Right.
It's not the activating agent or the situation that's caused it. It's your must belief or your belief about this situation that is causing your emotional response. In this case, anxiety. Okay, I got that.
Exactly. And you can notice here that in terms of diagnoses, most therapists use, at least in the US, use something called the DSM, Diagnostic and Statistical Manual, where they come up with these diagnoses like generalized anxiety disorder or borderline personality disorder or depression disorder. But I don't see that as very useful, because if my diagnosis is generalized anxiety disorder, that doesn't tell me what to do about it. But if my diagnosis is an irrational belief, I must not be late for work, then it's clearer what to do about it, see how I can change this kind of thinking, because it's not doing me any good. And then to do that, we go on to D. D stands for disputing or questioning the irrational belief. And the way we do that is a simple process. You just take what you have it be, the belief, and then you put it to the light of reality, empiricism, and say, what is the evidence that I must not oversleep? So that's D. And then we go on to E. E stands for effective new thinking, or the answer to the question, what's the evidence I must not oversleep? And if I think about it, I just find evidence why it would be highly preferable not to oversleep. And it would be highly preferable because if I do, I get disadvantages. And if I don't, I get advantages. So it's preferable, but it's not a must. It's not the end of the world or prove I'm a loser. And then to be more complete, I encourage my clients to write copiously at E, such as, it would be disadvantageous to oversleep, but not the end of my world, or probably not even the end of my job. I wouldn't like this happening, but I definitely could stand it. I have overslept in the past and I survived, and I'll survive at this time. And if I do oversleep and I'm criticized, all this proves is, at worst, I'm an imperfect human who acts imperfectly, not a worthless failure. And then finally, reminding yourself of the BC connection. It's not oversleeping that causes my anxiety, but rather it's my irrational must thinking about it. And with practice, I can change my thinking. And once you practice this exercise and others, I have many different exercises in the book that you can practice to help you change your thinking, then that leads to F, your new feeling or behavior. In this case, it would be great concern about oversleeping and taking the necessary precautions rather than anxiety.
So you're effectively modifying your emotional response to a situation by shifting your own thinking, your belief or your premises about it, from being something that must happen to simply a preference. So you're downgrading the factor, I must achieve this, into a preference, and then that helps change the emotional response. Is that right?
Yes, exactly. Yeah. Now, I think you could say, as you did, Nigel, I'm downgrading that factor, but a misunderstanding is that I'm downgrading the intensity of the emotion factor. Yeah. I could have a very, very strong preference not to oversleep, and therefore I'd feel passionately about it because, say, I was given a warning and this is a very good job that I'd like to keep, so I could feel passionately in my preference not to oversleep and have an intense emotion such as great concern or great frustration about the possibilities or my failures to get to work on time in the past or those kinds of things. So I could have an intense emotion. So the difference in disturbed emotions and functional emotions is not in the intensity, but it's in whether it disturbs you, eats you up inside, leads to rigid, fixed thinking, leads to compulsive strategies that you try over and over and over again, the same strategy, and your thinking is inflexible. So it's those kinds of highlights of demands, musts and shoulds, irrational thinking, and dysfunctional behaviors rather than the intensity.
Okay. It's interesting with musts, isn't there? I think that there's probably a couple of points to make about musts. You're obviously illustrating the idea that they're unhelpful when we attach them to outcomes that can't be guaranteed. And as we all know, there are many outcomes in life that we desire that can't be guaranteed, that we all shoot for, but we have to accept that it might not happen. I was amused once when I heard apparently some old saying that the only thing that you must do is die. That's the only thing that you actually have to do. Exactly. Everything else is optional to some degree.
Yeah, right. And that's not a psychopathological must, unless you're anxious about dying. But that's an if-then must.
Yes.
If I'm human, then I must die. It's not the kind that creates anxiety. So
is it there important to distinguish these different kinds of musts? I mean, I would call it perhaps a causal must. If I want to be a doctor, obviously I must study medicine. Right. There's those sort of things. So I suppose, just so that people don't get confused and think that all musts are bad, it's just these musts about our these outcomes, isn't it? Can you clarify a bit on that?
Right. Yes, that's a good question. And another way to put it is these psychopathological musts that lead to anxiety, depression, and anger are the dysfunctional ones and irrational ones. So in order to clarify what I recommend my clients do, and what I try to do myself, is when it's one of these causal musts or musts of prediction or must of reality, then I say use a different term. Don't use must, because then it gets confusing. So if I want to get to the airport on time, it's highly preferable that I leave at 9 a.m. so you bypass the must confusion. Also, another key difference between musts, shoulds, awful, terribles, can't stand it, so that kind of thinking that leads to emotional disturbance, and preferences, is that preferences are grounded in reality. I have a preference for X because if I achieve X, I get advantages, and if I fail, I get disadvantages. That happens in reality. But a must leads to global evaluations. If I must not be late, then usually the thinking is, I'm a bad person, I'm no good, I'm a failure. It's a global evaluation. Or if you treat me poorly and I think you must not, then normally that leads to, you're no good, you're a rotten person, you're a bad person. Those are global evaluations. They don't exist in reality. Musts and shoulds, these kinds of musts and shoulds, the psychopathological ones, the ones that lead to emotional disturbance, don't exist in reality. We just invent them in our own heads, like we've invented Santa Claus when we were young, possibly. And then we see there's no evidence for Santa Claus, so we give up the idea. So it's the same process here. Show yourself again and again and again that there's never any evidence for musts or shoulds or these kinds of demands, because they lead to these global evaluations that don't exist. As an aside, Nigel, you had mentioned some outcomes can't be guaranteed. Now, I would make the case no outcomes could be guaranteed. We have different probability levels, but even you can't guarantee that you're going to die, because there are scientists working on anti-aging genes and things like that, and maybe in 1,000 years they'll discover them. So I teach my clients, we live in an uncertain universe. There are no guarantees. So demanding a guarantee has two irrationalities. One is the demand, I must be guaranteed I'll get to the airport on time, and the other is looking for a guarantee.
That's a really good point, isn't it? And just to highlight, the issue is certainty, isn't it? And I think you used the phrase "certainty doesn't exist." But I would want to just differentiate. I think you're absolutely spot on. I like the fact that in terms of outcomes, nothing is certain, and that is absolutely valid. And I think it's really important for people to remind ourselves of that consciously and accept it. Say, okay, nothing is guaranteed. Your happiness isn't guaranteed. Your health isn't guaranteed. You never know what's going to happen. But I would want people to not allow that idea to sort of spill over into other areas where they might conclude that certainty in knowledge is impossible. I mean, I think certainty with regards to knowing something is true or not, for example, is perhaps a different issue, and maybe it's worth just distinguishing, because certainty with regards to truth about something, exists on a scale from sort of unlikely through likely, probable, and very certain, and is a measure of the evidence that you have for something. But would you agree that that's a separate issue, and we should try to keep that totally separate from the idea of outcome certainties?
Yes, I certainly agree, and I could quibble with you on that, but my area is not philosophy, it's clinical psychology, so maybe that's not a productive use of our time. But another thing I guess you can say is guaranteed is that because we're imperfect humans, we're going to make mistakes. So you can guarantee that too. Yeah. So maybe I'm wrong that nothing is guaranteed.
Yes, indeed. It's just very, very likely that there are no musts attached to any outcomes, and therefore we need to be sure to have preferences in order to what are the words, to not allow our emotions to get the better of us, I suppose.
Have preferences and not escalate them into demands, because usually the process is I have a strong preference, and then because of my human tendency is I have a tendency to convince myself I must have it. I have a preference not to get to the airport late, and then it's easy to convince myself that therefore I must not, and it would be the end of the world if I missed my flight.
So how does this relate into sort of people's tendency to say, oh, if I don't find this relationship, then clearly I'm not much of a man or a woman, whatever the case is. People sort of judging themselves. Do you call it self-rating? I'm not sure. In the book, I can't quite remember. But people tend to knock themselves down if one of their musts isn't achieved. And so this would have a knock-on negative effect on their own view of themselves, wouldn't there, of their self-esteem?
Yes, and you bring up a good example, because I work with clients who are single and would like to be in a relationship, and they have a must. I must be in a relationship, and because I'm not in a relationship, this shows I'm a loser. No one likes me. I'm unlovable. So that's a human tendency, and I show people that what they're doing, as you mentioned, is they're rating their behavior. So their behavior isn't the way they would like it to be, which is being successful in finding a relationship. But then they're overgeneralizing to the rating of their behavior, to the rating of their entire self, their personhood, their being. And that's an overgeneralization, and it doesn't make sense that because you're doing poorly in one or many areas of your life, this means you're a poor or bad person.
Self-esteem is not necessarily a central theme of your work, but it's a relevant issue there, isn't it? It certainly comes into it when people start to put themselves down.
Yes, it is. Self-esteem is a central part of my work, actually.
Okay, sorry.
And I have, that's okay. And I have a chapter in my book called The Self-Esteem Trap, and so there are a number of problems with self-esteem. I've also publicly debated self-esteemers on this topic. So the problem with self-esteem, you rate your behavior. I am doing well at my job. I have a good relationship. I won the last 10-kilometer race I was in. That's good. Therefore, I'm a good person. So self-esteem, a feeling of self-esteem is a feeling, emotion, and unlike all other emotions, it comes from your thinking, and that's the kind of thinking that it comes from. I must do well and get approval, and if I don't, I'm no good. I'm a bad person. So the solution is rate your behavior. That's important, because if you don't rate your behavior, you won't know what you're doing well and try to maintain it. And if you don't rate your behavior, you won't know when you're doing poorly and try to do better. So it's important to rate your behavior, but don't rate your overall self. Don't give yourself a report card. I'm A person or B person or things like that. So that's unconditional self-acceptance. So when you do poorly or people criticize you, you see that proves you're an imperfect human, not a worse person. Mm-hmm. And then the other solution is self-discipline. Figure out what you're not doing well in, why you're not doing well in it, and then work hard at doing better at it if this is an important value of yours.
Mm-hmm. I can see the value in obviously not measuring our sense of self-worth through any particular performance. That would seem irrational. That would seem to inevitably to lead to problems, and it would make one's self-esteem very temporary, pending that performance. So while you're doing well, you feel good, but as soon as
yourself.
About yourself.
It's
but
you want to feel good when you're doing well, but not about your total self.
Yeah, I mean, to me, self-esteem, I do see it as a very important component, a very important human need. But I see it more as reflecting on our own estimation of our overall efficacy as a human being. You know, if you're thinking, if you're switched on, if you're participating, if you you know, if you're proactive, if you engage with life, I think it's a lot easier to feel that you're an efficacious human being, that you can do this living thing. You know, everything is possible to you. I think that anyhow, that is possibly beyond the remit of this discussion. Maybe we'll come back and talk about it.
Actually, that's a very interesting subject of mine, and comes to the heart of the self-esteem problem, and that is, no matter how well you're doing, no matter how efficacious you act in many ways, you're still making the fundamental mistake of rating your behavior, this is efficacious behavior, and then overgeneralizing to your total self. But it's not your total self. Your total self is an imperfect human who acts imperfectly, so it's much more accurate and functional to say, I act efficaciously in these areas of my life, which you outline there very well, but that's my behavior, and who knows tomorrow what's going to happen. Probably I'll continue, but I could make a mistake. I could get into a car accident when I was distracted, and this is seriously injure myself or others. And then I go back to being a lousy person and low self-esteem. So high self-esteem has this other problem of being one side of the self-rating coin, whereas if you just unconditionally accept yourself as acting efficaciously in many areas, that's great. How can I maintain it? But that's great. It's not, I'm great.
Okay.
Does that make sense?
Yes, it does. Well, what about, just moving on to another concept in your book, you encourage people to debate with their musty voice. And the musty voice, of course, being that little voice in your head that says, I must do this, you must do that, you must do, you know, as you've outlined. And you advocate a continuance of this until you win the argument. If you're rational and you keep reasoning with this obviously irrational, musty voice, because it's just churning out these, you know, ill-considered and often hastily arrived at conclusions that we've filed away in our subconscious as a premise. So can you tell us a bit about that? And I suppose this relates into getting rid of the therapist as well, doesn't it? Because once we learn how to sort of debate with ourselves, if you like, ipso facto, no need for therapy or the therapist.
Exactly. And also doing the 3-minute exercise that I outlined earlier is really the kind of thing the therapist would do with you in the session, helping you identify your musts and shoulds and helping you question them and discard them. So you're exactly right, Nigel. This is another strategy, of which I have many in my book, 3-Minute Therapy, that you can use. And I call it debating until you win, as you suggested. So you write down one of your irrational ideas that you're grappling with. For example, I must be in a relationship. And then you write down a rational or reasonable outcome, rather response. So that's the rational voice. So I call it IV, irrational voice, and RV, rational voice. And then so for example, your rational voice might say, well, there's no reason I must be in a relationship. I prefer to be. And then the irrational voice comes back and says, but if you were in a relationship, your life would be so much better. You'd be happy. You'd be loving and receive love. You'd have a partner through life. So then the rational voice says, yes, those are all advantages. That's why it would be preferable if I'm in a relationship. You see, you're listing preferences, no world-ending scenarios. So it would be preferable. There's no reason I have to do what would be preferable. And then the irrational voice says, well, you know, you're just kidding yourself. You know, you really believe you should be in a relationship. And then the rational voice says, well, you're right, irrational voice. My problem is I deeply believe I should be in a relationship. So my job is to question, challenge it, and contradict it rather than say it's right just because I deeply believe it. And then if that silences the irrational voice, then you've won the debate. But if the irrational voice has a comeback, then you continue on until you show in all the ways that the irrational voice tries to put forth that those arguments don't work. And then if you're not successful in winning the debate, then you come to me and I help you win the debate.
I'm very excited about this whole approach because there seem to be so few professional therapists that seem to reverse this idea that emotions are, unknowable primaries to no, actually emotions are completely understandable, and they depend on our thinking, on our premises, and on our value system, and how we interpret events in the light of our established value system. So do you think that there's any sign, Michael, that this is changing across the profession? Is there a growing acceptance of the idea that we can understand emotions, do you think?
Oh, yes. I'm glad you brought that up because I think it's been changing dramatically. In the 60s, when I was in graduate school and I went to psychology conventions, I'd speak to some of the practicing psychologists there, and I told them that I was a follower of Albert Ellis and I believed in rational emotive behavior therapy. They'd poo-poo it, say that's crazy, and Albert Ellis doesn't know what he's talking about, and he uses crude language and things like that. It's intellectualizing. But these days, when I speak to other therapists, they say, and I mention I do rational emotive behavior therapy, they say, oh, I use some of that in my practice. So things have changed dramatically, and you can even see how many more therapists call themselves cognitive behavior therapists or cognitive therapists or rational emotive behavior therapists. It's very widely popular, at least to some extent in some therapists' practice, not necessarily total CBTers or REBTers, but to some extent. And there are more and more books using these ideas. An early one was Your Erroneous Zones by Wayne Dyer, which was on the bestseller list for many months here. And then there's Martin Seligman, who used these ideas as a springboard for his popular, rather positive psychology, which uses a lot of the REBT concepts and techniques. And Aaron Beck, who popularized the term cognitive therapy about 7 or 8 years after Albert Ellis started speaking and writing about rational emotive behavior therapy, which he called rational therapy at the time, but the name has evolved to rational emotive behavior therapy. So there are all these ways that Albert Ellis was a pioneer in this in the therapy field and dramatically changed the course of the therapy movement in a very positive way.
The conventional approach to psychology of just sort of going over and over and over those old problems in your childhood just doesn't seem to work.
But it does work for the therapist because the more you can excavate someone's childhood and talk about their relationships and situations rather than the fundamental issue, normally the longer the client will stay in therapy, and then the therapist can pay off their Bentley or their townhouse or their trips around the world or things like that. So I think there is this financial incentive, and we were discussing earlier about assumptions people have, and I think most therapists may not even realize that this is a motivator for them.
So where can listeners contact you, Dr. Edelstein? Obviously they can pick up a copy of your book, 3-Minute Therapy. And I think you have a website that offers that, 3minutetherapy.com. Perhaps you could give us some details as to how people can find out more about your work.
Yeah, and I wanted to mention that 3 is spelled out the word, not the number, in all these things. And also, I have a podcast called the REBT Advocates. Actually, it's a YouTube channel. So if you go to YouTube and you put in my name or put in the REBT Advocates, you'll see about 87 discussions about various areas in psychology and applying it REBT to that. And I'm starting a new video called Therapy Talk. I just did one or two. So that's another way. And then I have other lectures on YouTube, and I have other books. I wrote a book called Rational Drinking, How to Live Happily with or Without Alcohol, focusing on addictions, and Stage Fright, which shows you how to get over performance anxiety, whether you're a speaker or a musician or a dancer. If you have performance anxiety, this book, Stage Fright, would help you. And finally, I have another book which I wrote with the same co-author that I wrote 3-Minute Therapy with, David Ramsey Steele, called Therapy Breakthrough. And Therapy Breakthrough discusses the history of psychotherapy from Freud to the present and shows how Albert Ellis changed the course of therapy. And along the way, it criticizes some of the fundamental concepts that Freud popularized and other therapists still use, such as repression, which doesn't exist. The unconscious in the Freudian sense doesn't exist. And Oedipal complexes are fictions. So Freud was actually a great fiction writer, but also a great persuader. And that's why that so many therapists for a long time followed his ideas and his methods to some extent. And also some of his ideas were built into the culture. There were movies and books, novels based on this idea that the reason people have problems now is because of some traumatic event in their childhood. And the movie goes back to their childhood as a flashback and shows when their father was beating them or something like that. And that's why they have this weird problem now. So that's Therapy Breakthrough. And then another way to reach me is I have a email address and a phone number. And if you go to my website, 3-Minute Therapy, you'll find that. And you could call me or email me, and I'll be happy to respond to any questions. I also have an in-person, but also Skype and phone practice, and I work with people in Europe and Asia and those kinds of things by Skype.
Well, thank you so much for taking the time to join us today, Dr. Edelstein. It's been a great conversation. I'm fascinated by this therapy. It's a great read, the book. I'd recommend it to anyone. And thank you very much for listening, all of you guys. And I do point you to the website lawfulrebel.com. Check that out for loads more useful information on how to thrive and arrive at truth, so we can have successful lives.
Thank you very much for having me. I greatly enjoyed our discussion.
And I hope all you guys will join us again for the next episode of Living Outside the Matrix.